Welcome to Shri Medical College. Today we will explore Advancing Patient Care Through Optometry, B.VoC in Optometry at Shri Medical College. During an eye exam, your eyes and eyesight will be tested in a variety of ways. Your eye doctor will most likely have you look through a number of lenses and use various devices on your eyes. An eye exam evaluates your vision and eye health. Comprehensive eye exams evaluate the eye's structure and function. Both can be done in primary care, though secondary care tools like slit lamps and tonometers are necessary to rule out certain disorders. Full eye care is provided by ophthalmologists, who are medical professionals who specialize in the eyes. This includes providing comprehensive eye exams, dispensing corrective lenses, diagnosing and treating complex eye illnesses, and conducting eye surgery. Optometrists, like ophthalmologists, provide complete eye exams, evaluate vision, prescribe corrective lenses, diagnose common eye diseases, and treat particular eye ailments with medicine. Optometrist may recommend ophthalmology for advanced eye treatment or surgery. Opticians fit and sell prescription eyewear. Opticians sell contact lenses. Opticians do not examine eyes like doctors. A Bachelor of Vocation in Optometry and Ophthalmic Technology degree can lead to many different professional paths. Primary care, business, public sector, and academic contexts are just some of the places they can find employment. The tonometer is among the earliest tools for measuring intraocular pressure. There is a risk that the optic nerve could be damaged irreparably if intraocular pressure were to rise above a certain threshold. Glaucoma describes this abnormally high pressure condition. A tonometer gently touches the cornea to measure ocular pressure. If your tonometer touches your eye, use eye drops to make it more comfortable. In order to check for glaucoma or measure eye pressure, many doctors also utilize a device called an ear puff tonometer. An optometrist's phoropter is one of the most fundamental instruments used to calculate a patient's eyeglass prescription. Patients are typically asked to sit quite a ways away from an eye chart. The optometrist will try many lenses on the patient before asking which one works best for him. Since this is a subjective evaluation, the optimal lens for the patient to use is the one they report giving them the clearest vision. When the patient cannot communicate with the optometrist owing to a physical or mental problem, a retinoscope detects the refractive defect and prescribes spectacles or lenses. A hole in a mirror directs light into the eyes. The autorefractor helps measure eye refractive error and prescribe lenses. The patient has to stare into the machine, which displays a fuzzy, out-of-focus image. The sensor records data to ascertain when the picture reaches the retina. The averages of numerous such measurements are then used to build a treatment plan. The Snellen chart is a staple in any optometrist's toolkit. A real or digital chart with the alphabet in decreasing order of size is positioned around 20 feet, 6 meters, away from the patient. While the doctor determines the best prescription for the second eye, they will cover one of the patient's eyes. Patients are asked to read the tiniest letters they can while the optometrist puts different lenses in metallic eyeglass frame mounted on the face. The retinal camera is a device used to take pictures of the back of the eye, namely the retina. It is a customized low-powered microscope with a camera connected to it. A retinal camera allows the ophthalmologist to study the patient's retina, monitor the changes in the retina over a period of time and diagnose disorders. Modern retinal cameras take a series of photos using different filters to produce clear views of different areas of the retina. Optometrists also employ instruments such as ophthalmoscopes, which allow them to view the structures inside the eye, to diagnose and treat eye diseases. The device's light source, reflectors, and lenses allow retinal viewing. Eye drops dilate the patient's pupils to see the retina. The ophthalmoscope helps the doctor to see and identify the indicators of possible eye problems. Optometrists utilize the VT1 vision screener, a high-powered computerized equipment, to detect and diagnose serious vision issues in their patients. It's portable and simple. It detects numerous eye disorders without dilatation. A vision screener can detect visual abnormalities at all ages, even 6-month-olds. These resources are vital building blocks for the future of the eye care and healthcare industries. They aid in the diagnosis, management, and avoidance of vision issues. This eye testing technology is made available to doctors and other medical professionals so that they can provide the excellent treatment their patients deserve. When it comes to eye care, optometrists have come a long way from simply dispensing corrective lenses. In addition to supplying glasses, optometrists provide corrective equipment such as contact lenses and gadgets to support low vision. Optometrists, as primary healthcare providers, are the first to detect eye abnormalities caused by diseases like diabetes and arteriosclerosis, enabling early diagnosis and treatment. Nowadays, optometrists and ophthalmologists collaborate closely. Contact lenses, vision therapy, orthotics, learning disorders, pediatrics, and occupational vision are just few of the subspecialties available to optometry students. The first thing the optometrist does is ask why the patient has made an appointment, for example for a routine eye check, because their glasses have broken, or because of concerns about their vision. The optometrist asks more open questions to ensure they understand the patient. The optometrist makes the patient feel comfortable enough to ask questions through dialogue and encouragement. The optometrist provides just enough information, and does it in language that is easy to understand and free of jargon. The optometrist needs to modify their approach for each individual client. The patient's comprehension of the optometrist's instructions and recommendations is a top priority. Taking a patient-centered approach means remembering that it is the patient, not you, who ultimately decides what is best for their eyes. Optometry as a profession provides a good living wage, steady employment, room for professional growth, and a pleasant place to work. Patient-centered care can result in higher levels of satisfaction and increased adherence. Eligibility criteria for the B.VoCoptometry and ophthalmic technology, 12th class with a recognized board, 50% in 12th board examination. The age must be between 16 to 28 years. Optometrist salaries depend on their degree, experience, and the hospital's reputation. New grads may earn Rs. 25,000 Rs. 30,000 per month. Join Shri Medical College's Bachelor of Vocation in Optometry and Ophthalmic Technology and take the first step toward a successful career in optometrist. The demand of optometrists in India and abroad is continuously increasing. They make a health assessment, offer clinical advice, prescribe spectacles or contact lenses and refer patients for further treatment, when necessary. Offering primary eye care, optometry is a challenging, stimulating and exceptionally rewarding profession that offers excellent opportunities for work in India and abroad. Join Shri Ram Medical College's Bachelor of Vocation and Master of Vocations in Optometry and Ophthalmic Technology and take the first step toward a successful career in hospitals. We are here to assist you in launching your medical career. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.